Welcome to InConversation, folks. We come to you from Washington, D.C. My name is Ramesh Bhutani.
And I'm Anisha Abraham.
Folks, President Obama just returned from visiting the Asia-Pacific Economic Cooperation Forum in Singapore, and then he also went to Japan, and then he went to China. And I want to tell you, the highlighted trip was China. And he did not get an opportunity like he got in Cairo in Egypt when he went to Middle East. He was able to talk to the university students. He was really able to impress them because he's personally very famous. But in China, they did not allow him to go through that.
There was one very well-orchestrated experience that he had with students in China. And interestingly enough, we know that that was not televised. In fact, I think it was only available on the Internet. His discussion with students in various elite universities that were somewhat handpicked.
But that was arranged, actually. They were bussed in,
Right.
They were trained to ask, so how do you get a Nobel Peace Prize? I mean, come on. No.
Well, what I do think that the president's visit brought to the forefront was the reality that we need to take China as a world power very seriously. Yeah. And certainly we need to be dealing with them as we talk about international diplomacy. And I would say that President Hu and President Obama's discussions certainly highlighted a number of issues to include discussion about financial issues and about climate change and even about nuclear proliferation. And I think one important issue as we talk about financial issues is that the U.S. is now China's most important export market.
It has been a very good export market for us, too. But in reality, if you see it, we shut down so many industries here to be we couldn't compete with Chinese labor. We could not compete with the wages that they pay. So we had to shut down our factories. And the government thought that that was the best way to go, being global and others. But now I think President Obama gets it. He realizes we cannot just stay down this way. We need to come up. So we need to start building things and exporting things. I completely realize China is extremely important, but we need to build a policy where we make sure that they also respond to our requests, which is that we don't need that much import from China. We need to build our things. Just like they've been asking Boeing Company and the others, hey, we will give you the contract if you come and build it in China. Well, let's do the same thing, Now,
I think the President and President Obama and President Hu have made progress not only in the financial discussions, but as I mentioned, also in talking about climate change and nuclear proliferation. Where critics are concerned is the issues in terms of human rights. And what Obama did say, and I think he was somewhat savvy in saying this, is he said, we recognize that Tibet is part of the People's Republic of China, and we will support continued dialogue when it comes to talking about the representatives of the Dalai Lama and reserving any concerns and differences. And we also applaud steps that China has done in terms of reducing tension with Taiwan. What critics say is that he could have taken it further in terms of really talking about the human rights abuses, and he kind of shied away from that. And whether or not, again, this could have been a place where he could have used it as a platform to talk more about China's role and what they could be doing is certainly up for debate.
And it's just amazing to see a country in slow motion. I mean, it's only been, 25 years at the most that China has come from absolutely nothing to a powerhouse, third largest economy in the world now?
I completely agree. I just actually came back from a trip to Hong Kong, and it's just incredible to see the amount of growth and the amount of people that are now migrating to Hong Kong, and as a result also to China. And really, in terms of its financial development, I think it's just absolutely stunning.
Healthcare debate has been raging for so many months now, but this Business Week story says there are 10 ways to cut healthcare costs right now. Employers and hospitals don't have to wait for Congress to address inefficiencies and waste. And one of the things that I was surprised that the biggest concern they have is in the hospitals when you go to get treatment, you actually pick up infections there.
It's very true. It's something actually that most hospital staff are very aware of. They do a lot of training. They really try to prevent infections that can be caused just by coming into the hospital, whether you're hospitalized or even in a clinic setting.
Second thing is about we are a nation that's not fit. 1/3 of U.S. adults are obese, and health spending on this group grew 80% from 2001 to 2006. to $166.7 billion. In Rochester, New York, Wegmans, in cooperation with the companies like Bosch & Lomb, Eastman Kodak, Xerox, and some of the other businesses, what they did is they created these health programs for the entire metropolitan area, free.
That's fantastic.
Yeah, and 44,000 people took advantage of it, but more can take advantage of it. Another one is develop a healthy workforce. Johnson & Johnson, very big on it. The CEO met President Obama. He told him that his entire company makes sure that there's exercise rooms and exercise available and nutrition information available to their employees. So what people are doing is they're taking control of their lives because this spending on medical is just going out of control. But the biggest thing is that we can't control it. Even though we want to own the health care, we don't own it. None of us has any control on it. And
I think that's an important point, the fact that individual companies and individual groups are trying to take some onus and some powership, and that's how it should be. You can't expect only the government to be the one to regulate healthcare, and certainly, again, if a company can really make it the motto that they eat healthily and that they have yoga and exercise and time for their employees to actually exercise and do things, that I think sets a very good precedence in terms of making sure everyone is healthy and that they maybe decrease the cost of healthcare as a result.
One of the other things that they talked about is specialists don't talk to each other.
That's true.
They have to have a primary care. So what they need to do is whatever information or medicines that they're taking, they need to put it in one place, which is the primary care. So they're saying the primary care physician should be the driver of your medical health, and that's the person you want to make sure you continue with all the time.
Which is the medical home concept, that there's a place that people can come to, and it's usually their primary care. But we've talked about this before. Primary care physicians don't get paid very much, and they have to see lots of patients. So it's very hard for them, when they have complicated patients, to spend all the time that they need.
That's right, and that's where I remember once you said that if they can spend 15, 20 minutes, 30 minutes with a patient, that somehow they will need a lot less care. Just simply by having that primary care physician in charge of their health care. One other area of concern is fraud and abuse. In the last few years, folks, the fraud in the medical industry has really gone way beyond, and only because they're thinking that mafia has gotten into this business.